trials are available in Dr. Dekwan's days, Varun Shigru Kashaya, in different variety of inflammatory conditions, including cystitis and rhinitis and all sorts of rogas. They have tried and it has been effective. Publications are available and donated to SERPs, CCRS journals.
Actually, Shigru has a wonderful potential to do many things. For example, in Germany, already Dr. Jeevan told me that it's already available. Shigru leaves powder is available in a capsule. It's available in the market here. And also the seeds. Shigru has a wonderful potentiality in especially these type of ENT areas. It's really, we are using in many different conditions.
I am doing.
As we call Jatru Pratyurdam, head and neck, we call in Sanskrit Jatru Pratyurdam.
So
all diseases above this. Varun and Shigru both in combination. Single drug also.
Yeah.
So it's sort of like an ENT Rasayana? Could we just like,
No. It's very Ushna Virya. Shigru I am using also for allergic conjunctivitis. We had made extract out of it and then did packing in modern ophthalmology. And those drops we are using for spring catarrh as well as simple allergic conjunctivitis.
For those of us who are not acquainted with the Sanskrit names, can you give us the botanical name of Shigru?
Moringa oleifera. It's moringa, different varieties. And this I think, I don't know.
Here it is not very common. Otherwise in North India, everywhere.
We make pickle out of it. In South India, drumstick is the common name.
Is it available here on the market as an extract or as a churna?
Now it's available as a powder in the beer market and also available as seeds. Like 10 seeds cost €2 each.
And how do they call it in the biomark?
Moringa seeds, yeah.
You can also go to Body Shop, they already produce the moringa butter and everything.
Perfect. Well, thanks, Jeevan, for that. So you can just go to the organic store and get it right there.
Leaves are known to have the highest quantities for vitamin A.
Great. So, Hans, maybe to continue that run, I mean, you're seeing a lot of patients who sort of also come to your practice as a last exit. They have seen a lot of conventional physicians and are very frustrated at times because they do not see any relief, or they're seeing a lot of side effects of conventional treatment. So, what do you say on that discussion?
Of course, the patients are not always free of guilt, because many patients, to get rid of a blockage of the sinuses, take Otrivine, which is a highly potential aggravating substance. And as a result, I have seen and treated many patients who lost their olfactory sensation. And that is very frustrating for them. They say, now the spring is coming and I'm not smelling the spring. Or the fall season brings a lot of wind, and when we feel and when we smell it, or even the food, they can also not smell it. So there's a lot of frustration. So this type of patients come to us here also. And we usually treat them with a series of Nasya Karma.
But do you actually, also that question goes to all three of you, do you happen to see a reversal of disease stages where in conventional medicine you would say that's it, there's nothing else to do other than treat the symptoms? Do you see, for example, in cataract, that's one indication that you mentioned, do you see a betterment of the disease entity? So to say, undergoing Ayurvedic therapy?
Surely. For example, just like I told you, a chronic tinnitus or a chronic headache, many times patient will be really fed up with all their consumption of all these regular medicines. They are looking for how to get cure out of this problem. So such situation, definitely Ayurveda has a great role to play, because we can, many times this have multiple causes starting from a stress, and it has many role to play. And as an Ayurvedic physician, we'll be able to understand and we will be able to correct them in different plane, like to correcting their food, correcting their activity, and in stress, many levels, so that along with our medications, the whole collective information make the patient more comfortable and they get wonderful results.
Well, great. Well, maybe one step further into that direction, and also from my personal interest, I just had a number of patients with ENT tumors, or in particular larynx carcinoma, who had undergone chemotherapy and in particular radiation of the head and neck region. And they were, a lot of these patients, and I've also heard it from colleagues, they're very distressed and very frustrated because of all the effects that all that dryness and the heat that is due to chemotherapy, in particular radiation, causes. And there is no treatment in conventional medicine other than, continuously drinking water and, maybe some, medicated candy that they chew on. But treatment is very frustrating, and the patients are under enormous stress and even sometimes getting depressive due to the absence of effective therapeutic strategies. So is there any, Manjusha, maybe go for that. Is there any treatment options in Ayurveda to treat the side effects of chemotherapy and radiation in case of ENT cancer?
See, yesterday in Gurukula, I had given that point that we had conducted in our institute that Yashti Madhu as a local application in oral cavity as an adjunct in patients undergoing chemotherapy. So that Yashti Madhu local application with honey that prevented mucositis in the oral cavity.
As a churna.
That study is done, and I think article related to that you can see in our Ayu journal. It is available freely online, journal on web. So you go journal on web, on online journal, then Ayu India, and then you can see HM Chandola, because he was the guide of that work, and you will find the details of that. And another, my experience with the cancer patient.
Just going back to that, because that's very interesting, and I don't see a lot of iPads and smartphones here right now. I mean, what would you actually do? How would
Pratisarana, I will be explaining tomorrow. The local application, like we take powder, 1 gram or so, mix with honey, and either with the finger or with the applicator, wherever you are having oral ulceration or tonsillitis, you apply. And what will happen after the application, there will be salivation. So I'll ask the patient to bend and let it out. They don't have to swallow it. So whatever secretions, because honey itself will stimulate the secretions, it will decrease the inflammation. It is having antiseptic action also, antibacterial activity also. Honey has got wonderful or many actions. Now modern people are working for honey. One of my guide or teacher for modern ophthalmology, he is using honey in herpes simplex. I only gave him honey from 2 sources, one from Nepal and one from South India. And when I asked for the results, he told, no, let me publish and then I'll tell. Though I only supplied him the honey from 2 sources.
What about licorice candy? I mean, that might seem like a very stupid question to you, but would you also accept that? Is that
licorice candy may be there, but what will happen with candy? It may cause again with the ulceration. Like something keeping in mouth for a longer time itself causes ulcer. So if for powder pratisaran, or simple honey application.
It has been always used for cauterization and actually stuffing ulcers.
Yes.
We are always applying honey with neem paste, and if you apply honey, the neem paste, and put on this 3-4 days, even payasanous ulcers
Will.
I think you had another example of tumor treatment.
Yeah, I have a patient of osteoma of external ear, and that patient is poor economic status, and he don't want to go for surgical treatment. And actually, these osteoma are slowly growing, and exostosis was there in the external ear, and mucosal hypertrophy was also there, and he was having so much pain. So we started with the Chand Prabhavati, then Manjishtadi Kvantha, that Rakta Shodhak. I gave him Rasayana combination. Then he was having that mucosal hypertrophy. We did Apamarga Kshar ointment. Actually, I took from Shalya department. That was my own imagination. That because there is a mucosal hypertrophy, we will do Shar Malhar application. We did that. So all that his external ear cavity was open comparatively. And I have repeated CT scan. Osteoma is stagnant. Since more than 2 years he is coming to me. But as he is having osteoma, he is having referred pain in the hand also. And in the multi-joint pain. But he is under control. And for the osteoma, he don't want to undergo surgery. So we are managing with our medicine since more than 2 years.
Well, complex case, but the first case you presented, again, I feel that is a very good example to show that we can really do great things with small therapeutic items. And not only that, but the patients can do that themselves at home, and they don't need a therapist to do it. So I really like these ideas. So is there anything from that field, from the field of palliative medicine in for example, in cancer or any other palliative conditions that you would that comes to your mind spontaneously, Nambiji?
Such cases, normally in our hospital, what we do is Shirothara with milk. We make Dashamula Kashaya and we mix with milk. We boil the Dashamula with milk like Shirapak, and we do Shirothara. And it's showing wonderful result because, the qualities of milk with the Dashamula. I think it is also available in Germany. I don't know. Dashamula is available.
Yes, it is.
Yeah. So it shows wonderful result because what they have, the real presence of the ruksha, all these vata aggravating symptoms are really coming down. So this is what I do commonly. Otherwise, and when the patient get discharged, I oftenly uses most popular prescription from our place is called Chirabala 101. Very, very easily available, which will be made with milk. I'll ask them to add few drops of this Chirabala 101 in there. Then ask them to make a gandusha, just make a gargling. That can be very easily done for them. So this makes them very much comfortable, and they feel very much less irritated in this area.
Can you tell a sentence about Kshirabala 101? Because I don't think most of the people here know what Kshirabala 101 is. I do, but I don't know whether everyone else does.
It is a simple formula that an oil is prepared out of, normally an oil is prepared, to prepare an oil you need two things. One, a powder is called kalka, and next one thing is a decoction or kashaya. So here the decoction made out of the bella, Sida cardifolia, and the powder also the Sida cardifolia. And only thing that one of the component besides the sesame oil, you have a part of milk. So once you prepare this oil, that kalka with bella and kashaya and milk, that is the first outcome of Shirabala 1. Then next time, instead of taking the plain sesame oil, if you take this prepared oil again as a process, and again you add kashaya, kalka, and this thing.
Milk.
Then after milk, after repetition, this will become 2. If it goes like 101, it is called 101 repetition. So it may take industrially, may take 3 months or 4 months.
Right. There's a question over here.
Yeah, I think it's rather expensive. So if you guide it, you need a big amount.
No, it's not really expensive.
You said a drop, right?
Yeah, it is drops. I'm not told to do.
Don't take the whole bottle.
No. No, not at all. I told you take some 20 or 25 ml of milk, add 10 drops of Chirabala 101, add a gargle.
And but we're running out of time, and I would actually like to ask you guys, since I'm a great fan of integrative care. I mean, Hans and Manjusha and Nambi, do you have any principal objections on working together with conventional ENT specialists? I mean, is there any good reason to say no for an integrative approach?
There is no objection for integrative approach. Rather, the persons who are coming from the modern side as a teacher to our institute, they refer the patients which they feel they cannot treat. So that is our rapport with them. Like I'll give you one example. Automycosis, fungal infection, is difficult to treat with clotrimazole or other antifungal drugs, and even that is more causing irritation. Local ototoxicity also is there, And internal antifungal drugs, we know they reduce the immunity of the patient. So when he saw that I am using certain oils in the fungal infection of the ear, he started referring me those patients. I have done 4 theses on otomycosis, with the details I will be showing in my tomorrow's presentation on otoria.
So a very fruitful combination also, and the
That is a
collaboration with
very,
your conventional
that is,
colleagues.
So with modern people, definitely with open mind, we can collaborate and we can work.
Hans, what do you think? Sort of as a
Well,
closing statement also.
I mean, I always state, and to our students, I teach that as far as Ayurveda is, we don't differentiate between alternative medicine, complementary medicine, integrative medicine. I feel that the old idea of Ayurveda is that anything that helps the patient to recover is for us Ayurveda. So from a real Ayurvedic physician, he should not make this distinction. So whatever is good for my patient, I have to support, and whatever is bad, I have to protect him.
Well, thanks. Unfortunately, I'm not a real Ayurvedic physician, but thanks anyway. I totally agree with you, and Dr. Nambi.
Absolutely agree with Hans, sir, because the knowledge what and all a student will have is he should not make a compartmentalization of that knowledge. Let me give you a simple example. When I was teaching an Ayurvedic student, so you know that in medical knowledge, people will be learning a lot of modern knowledge, sciences too. So a patient comes and showing the patient that patient has a lower abdominal pain and pain in the thighs and pain in the backside. Okay, I asked the student, what do you think about this? Okay, he examined, he told, no sir, anatomically I don't find any correlation between these thighs, lower abdomen and back. Maybe, okay, we'll think about to write something. Then I asked a question, what is the site of Vata? So, the lower abdomen, the pakosha, kati, the thighs and these are 3 other common sites of Vata. And unfortunately, he missed the track of process of thought in Ayurveda, which should not be missed by anybody. Any knowledge comes to the world will be part of Ayurveda, because Ayurveda is mother of all knowledge system. Ayurveda can occupy like this, it can occupy any knowledge system because it's made in such an open knowledge frame. Thank you.
Thanks. It's what we call in Indian sciences, what we call inclusivism. And you've just gave a perfect example. I think it was a very vital discussion, and I would have liked to continue this for another hour or two, actually. And I also see by the degree of attentiveness. Yeah, so that you also enjoyed it, but we are out of time, and I really want to thank you, all of you, for participating in that round. And unfortunately, Kalyani couldn't make it, but the discussion was great nevertheless. So thank you very much, and I think we're off to dinner now. So have a great evening. Okay, thank you.